Breathe in, breathe out. One more. And out. Good.
You got posterior, inferior, alien up here on the left. So we just should have. All right, so we got Mike's x-rays here, and you can see right away lots of wear and tear in the spine. So you can see down in here, I mean, good disc space, bone growth in here, disc space starting to get smaller, more bone growth, small disc space, bone growth. And I mean, he had a motorcycle accident, pretty severe one, like 40 years ago. So a history of some major trauma. And he's been dealing with acute chronic exacerbations of the low back, meaning really severe low back pain flares up on him from time to time. So these are lots of times the toughest cases because his body's been just slowly deteriorating for decades. And his misalignment's pretty nasty. He's got big lower angle here of about 4.5 degrees. You can see that, that's this line right here, yellow line. Neck's kicked up on the left by about 1/16 of an inch, and head tilts off by about 1¼ degrees. So he's right on the cusp of being left or right. These are also kind of tricky. So we're gonna start adjusting him. You can see the low back here. He's got some facet arthrosis in the lower back. Meaning basically arthritis and degeneration in the facets. And so that just tells us this area has been deteriorating for a long time. About almost a 1/2 inch tip in the hips. You can see the lumbar, lower back being pushed over, a lot of tension. So we're gonna start getting it adjusted. Obviously we gotta get his alignment fixed. Probably gonna need some traction for the low back, some segmental adjustments in the low back, of course, and most likely some cold laser as well. And then we'll go from there.
Go ahead and put your arms up in front.
I told my wife I want to do like a ballroom dancing class.
Oh, that sounds fun.
Yeah, well, I want to be able to do it.
Probably be able to do it, exactly.
See, my wife and I, we're like totally opposites. You know, I'm so, physical. I want to be physical all the time, and she's just like, she wants to help with her chickens and eat and do it and weed. You know.
And we, yeah. Go ahead and slide that foot in on the left. Good, a little bit more. Good, arms down to the sides. Great. All right, so stay right there. Go ahead and take a step up and out from there. Great. Next to our seated, just be careful getting on. Good. Oops, and you can slide back if you need. Great, right there. What kind of ballroom dancing would it be? Salsa?
I'm not really sure. I almost want dancing class. I just want to stay mobile in the winter and winter months.
Oh, that's a great idea for the winter. Yes.
And you'd be better at weddings and stuff too. I was always a big dancer at weddings.
Oh yeah. Eyes closed for this one.
My grandma, she was a caterer for weddings.
Oh.
So I did one in Detroit. I just went to Detroit and help her out.
Chin down a little bit. Good. Hold still there. next one you're going to feel perfect. So let's go into
That's why the camera set up there for the case study.
yes,
So the case study, is that for you guys or for teaching?
both.
Okay.
Okay, great. So that one's okay. So we're going to flip you around to the other one. Have you place your chin up and on the paper. Great, just like that.
All right, so here we have my before and after, and this is a great example of my post x-rays or re-x-rays after 1, 2, 3, 4 adjustments. If you're doing upper cervical NUCCA-style adjustments, is so important. So before, his lower neck was about 4.5 degrees almost, now it's 2.5. Really nice improvement there. But the head tilt went from about almost 1.25 to about 2 3/4, and the neck went from 1/16, the atlas went from 1/16 plane line right there to 4/16 plane line. So the neck is more centered, but the head and neck shifted off. So this happens in, I would say, almost half of the people that come in here. It's a two-phase correction. So his body is in better alignment, but it's not corrected, and so he's feeling the same. And so we're going to keep rotation the same. We're going to change the height vector. That will allow us to then center and level out the head. And then his body will hold, unlock, things will relax, and then his body will be able to heal. And eventually, sometimes right away, sometimes it takes time, but eventually he will feel better and his body will truly heal from the inside out. So this is why post x-rays are so important. I always tell my patients, that don't want to do them, it's so worth it. And it's the only way to know for sure that you've corrected the misalignment. You can check posture, that's great. You can do scans, those can be helpful. There's a lot of great things out there, but nothing other than if you had an upright MRI, but those are not very practical. I think there's only one in the whole state of Wisconsin. So, but x-rays for practicality and clinical information and feedback are invaluable. So we'll tweak his adjustment and he should be in really good shape. And again, have I seen a 3-phase correction? I have seen a couple. They're very, very rare. So 98% of the time, after this, he'll be in good shape for a while, months or years. We shouldn't need to take new x-rays and change the angle of his adjustment, the upper cervical Nuka adjustment, for a while usually. So we'll do it and we'll see how he responds and we'll go from there.
back on the pillow.
You got siblings?
I do have siblings, yep. I'm the youngest of 4.
Yeah, there's 4. And they're all married?
2 are.
Well,
Relax your legs there. Good. Perfect. Okay. Whenever you take your glasses off, put them over there. It's fine. You lost your change again.
yeah.
That's all right. I'm gonna have you come on up and I'm gonna have you face the window. So have a seat facing the window. We'll get all the change later. Okay, slide up right ear into the notch here.
Okay.
On your right side. This way, so I'm gonna roll this shoulder forward, the left shoulder goes forward. There we go. You can grab onto your arms if that's a little easier, or cross leg, that's fine. Okay, come on up and we're gonna have you stand on the posture stand again.
This?
Yes. Good. Step off and step back on again. And then arms up in front. Arms down to the sides. Go ahead and hand it back over here. So go ahead and raise the right leg one more time, left leg. Good. Okay, so is the right side easier?
Yes, a little bit.
Okay, bring the right leg up again and left leg. Great. How'd that feel this time?
Yep, better. Do it again.
Do it again. Repeat, repeat, repeat.
Exactly. It helps, repeat.
I can tell it's tender up here though.
Yeah, right there, yeah.
raise the right leg up one more time. Perfect.
Yep, that's
Left
better.
side, much better.
Yep.
Go ahead and breathe in, breathe out. One more. And out. Good. Perfect. Come on up. Much better.
All right, Mike. So when you started, the right low back pain was like 10 out of 10, going on for about a month consistently. How is it doing now?
Well, the last 4 days, 3-4 days, it's been maybe a 2 or 3.
Awesome.
Yeah.
Awesome.
No really bite where I can't get up,
Awesome.
That's what I like.
Yeah.
When I'm stranded down, I said, Jay, you got to get me up.
Yeah. Well, the reason it was kind of on and off there for a little bit, it was kind of a little better than it wasn't, is because you were a 2-phase correction, so we were kind of halfway there, and now you should be in really good shape. Let's just check your posture standing. And we knew that because your posture had changed a little bit and your weight distribution had changed. Yeah, I mean, you used to be leaning way to the left. The weight started, you had about almost 20 pounds more on the left. Now it's only a few pounds.
Okay.
It used to be several inches out to the left. Now it's probably maybe a ½ inch. That looks really good. Let's have you come lay on your back for me. Yeah, and your legs are balanced. You can relax them. You can let them be relaxed. Yeah. Beautiful. So you're holding. Really,
Okay.
really good shape.
Good.
Good. Let's have you go face down. We'll just release some tension. All right. And let's have you lift your right leg straight up. Good. And down. And the left. Good. And down. One easier than the other.
Actually, I think the right may be a little better.
Yeah. Look that way. And lift your right leg straight up. Good. And the left. Look pretty good. How'd that feel?
Well, the right is going to go better than the left.
Where do you feel the tension when you do the left? Right in there? Okay. Yeah, you got a posterior, inferior alien up here on the left. So we just should get it. Lift the right. Good. And the left. How was that?
Pretty good, a lot better.
Yeah, yeah. So that was some rotation here in the left hip ilium and then also in the tailbone. But that's really good. And come on up.
Since I've been seeing you, basically, I haven't been doing any doing some benching or anything like that. I have a hoist gym set, and I'm always doing a lot of chest.
Yep.
You
You can start doing some of that again.
Okay.
Yeah, so what we want to do now is start challenging it and getting back to your normal activities and exercises. See how the body holds, see how you feel, and kind of go from there.
Okay.
All right? So let's go put you on the traction for a little bit, and we'll go from there.
I think I don't really know. I think maybe a little of everything I'm doing right.
Yeah.
The icing, the heat.
Icing's really, icing's great. All of that is going to now work so much better because your body is maintaining good alignment.
Okay.
It just took us a little while to figure out that you were a two-phase correction, which happens probably almost half the time. But you're going to be in good shape now. Let's check you out here. Yeah, your legs are balanced.
Okay.
Let's have you go face down. Okay. Lift your right leg straight up for me again. Good. And the left. Good. How did that feel?
Good.
Yeah, good. Okay. And then let's check you standing on the posture analyzer again.
Yep.
Yep. Yeah. When you started, I mean, your upper back was about an inch to the left, your pelvis was about an inch to the left, and you were carrying about 15 pounds more on the left side of your body. Now it's a couple pounds different.
Okay.
Pelvis is centered, and upper is maybe just a hair off. Not much at all. Come on out. So very, very good.
So, are there some extra stretches or exercises I can do?
Absolutely. So, one for the low back that's very simple is every morning just get up and just side to side
Okay.
and front and back.
Okay.
And what that's going to do is literally that motion. And you could get a
It's going to like centerize your...
Well, it actually, it opens up the disc spaces, so it'll get fluid in the disc spaces and the connective tissues. It's just going to take them to that end range of motion, which will also help hydrate them. And just by using them, one, they need motion. Motion brings in fluid and gets rid of waste. So that'll be very helpful. And then if you don't use something, you lose it. So if you don't actively use those ligaments and tendons, then when you go to bend and grab something, eventually you're very prone to injury because you haven't used it at all. It gets almost arthritis is kind of like rust.
It tightens up, and then when you use it, it like pulls it.
Basically, yeah. You know, it's kind of like a rusty hinge. If you haven't used it in a year, and then you go to try to swing it, you might snap the thing.
Right.
So that would be a very easy one I would start to do. Along with that, you could just get some rotational as far as a stretch. You just bring one leg over.
Okay.
Very easy. And bring one leg over here. Very easy. And then along those lines, you could also just kind of get a lateral lean both ways. And then again, you could either do a cat-cow, so just sit and go up and down and just hold and hold. Or you can come all the way onto your knees and just...
My wife does those a lot.
Yep, and they're good. And then you can drop back.
Okay.
So I'd start with just some simple ones, but just start with that wobble one and then stretch each way.
Right.
So yeah, just side.
This way?
You're going to go kind of try to, yep. And then try, instead of moving your upper body, try to get the hips involved. So really try, almost like you're downhill skiing. Boom.
Okay.
Boom.
Okay.
So is this one, and this one pushes, yep. Good. Yep. And then just feel that kind of, and just stay in the, you can stay in the same
plane.
Don't really
twist. It's kind
like that, and then that.
Right.
And then that, and then that. That, and then that. And then when you go forward, try to do the same thing. Try to feel that movement in here.
I can feel it back there. Yeah.
And then go the other way. Yep. Yeah, and breathing's great. Yep. And just do that for 5 minutes every morning.
Okay.
And I would just literally start with that. At the end of the day, if you had a big day, activity-wise, exercise-wise, you can always ice it.
Ice, before I got here, ice all the time.
Okay, perfect.